My name is Nasim Chowdhury. I'm a practitioner with the Office of Cannabis Management. It's just that week after week, hearing from patients and my oncology colleagues and my stroke colleagues or my GI colleagues, right? The question always was, you're treating, as an example, chemotherapy, neuropathy, with all of these different modalities. Are you planning on looking into medical marijuana? So professionally, I just couldn't ignore it anymore. And so that's really what prompted me to go down this road. My job is not to push my treatment choices onto the patient. My job as a physician, invariably, regardless of the treatment we're talking about, is to educate the patient about the pros and the cons, about the science behind the treatment, and leave it up to the patient as to what treatment options they want to pursue. You have to, as the treating physician, work within your guiding principle, which is do no harm, right? That's the guiding principle of medicine. As a physician, it's incumbent on you to keep up to date with the literature, and as treatment options evolve, it's your responsibility to stay abreast of those treatment options. Cannabis certainly happens to be the current topic, but that's relevant to the treatment of any pathology with any treatment. The cannabis is interesting in that it's one of those medications that we can actually use a lot of the treatment side effects to our benefit. So as an example, when someone is naive to cannabis, I'll tell them that you may potentially feel hungry, you may feel sleepy. Well, a lot of our cancer patients have marked difficulty sleeping. Chemotherapy destroyed their appetite. And so in addition to treating their pain, you're actually now able to use the side effects of the cannabis to help them in other ways. I can think of numerous cases where adding medical marijuana to a patient's treatment regimen would be a great additional step, but the stigma kept the patient from advancing. I think open communication between practitioners and patients is critical. I think if you're a patient who's interested in medical cannabis, that is a conversation you should have with your primary care doctor or your physician.